Hello everyone. Welcome to this video on whether COVID-19 can damage the brain. As we all know, COVID-19 has brought a lot of challenges for our daily lives. One of the biggest questions that we have is whether it can affect our brains. Well, in this video, we are going to explore that question and provide you with some evidence-based information from recent research. So, can COVID-19 damage the brain? The short answer is unfortunately, yes. COVID-19 can damage the brain in many different ways. When people first become sick from the virus, they may develop encephalitis, which is inflammation of the brain. This can cause confusion, difficulty concentrating, and even memory problems. COVID can also trigger the onset of new psychological disorders such as severe depression or anxiety. It can even cause people to become psychotic. That is, to see and hear things that are not there and to believe things that are not true. In addition, the COVID virus can infect and injure the linings of the blood vessels and make blood clot very easily. These two things together can lead to strokes and heart attacks, even in young people. Sadly, there are many examples of very young patients having sudden cardiac deaths and suffering from stroke. COVID-related strokes can cause permanent difficulty in speaking or understanding speech, weakness in one side of the body, and many other symptoms. Even if people escape from brain damage during the initial attack of COVID-19, they remain at a considerably greater risk of various brain conditions, as I said, including strokes, depression, anxiety, and psychosis for the next several years. People who were initially severely ill with COVID are at a much greater risk of cognitive decline after they recover. Even people who were less severely ill remain at somewhat greater risk. A large study of MRI scans taken before and then again after people got COVID showed that COVID can actually shrink the brain somewhat. In one study, the researchers found that after 1 year, those who had COVID were 63% more likely to have some kind of cardiovascular issue, resulting in about 45 additional cases per 1,000 people. So, let's also talk about the lingering symptoms of fatigue, pain, and difficulty even thinking that can last for several years after COVID. And this is called long COVID or post-acute COVID syndrome. These symptoms may well be caused by ongoing low-grade brain inflammation caused by the virus itself. So if you're lucky enough not to suffer brain damage during the initial stages of COVID, you may still suffer from the long-term effects of it. What can we do to prevent brain damage from COVID-19? Well, fortunately, most people who get COVID don't suffer brain damage because of the virus, but some do. And even people who initially just get mild COVID symptoms are also at risk. So, COVID's potential to damage the brain is just one more reason to do everything we can to avoid getting this disease. And to avoid, we all know that masks and practical social distancing are still very important, especially in crowded and indoor public spaces. Ventilation of the closed spaces is absolutely important because COVID is an airborne disease. And also vaccines. They have not only greatly reduced the risk of getting COVID and of becoming seriously ill from COVID, they also reduce the risk of suffering long-term damage from COVID, including the damage to the brain. So if you haven't yet, please get vaccinated. So in conclusion, COVID-19 can damage the brain in many ways, but thankfully, we can do something to prevent it. Avoid crowded places, wear a mask when possible, practical social distancing, ventilated spaces, and most importantly, get vaccinated. Let's all continue to work together to stay healthy and safe. Thanks for watching and see you in the next one.